From the anterior view of the cranium, we can easily view the various bones that compose the eye orbit. So in our previous video, we discussed the frontal bone, unpaired. See that anteriorly here forms the upper or roof of our eye orbit. The maxillae and the zygomatic bones form that sort of lower or inferior border of the orbit. And then we have a number of smaller bones that are a little bit trickier to see on the gross example that are within the orbit itself, or sort of in the deep cranium, and are better viewed from the intracranial space, which we'll do in a little bit. So within the orbit itself, we have sort of the butterfly-shaped sphenoid bone. And the sphenoid is really complex. It has a lot of foramina for cranial nerves and vasculature to travel through. Okay? So I definitely encourage you to study this in the lab and individual diagrams of the sphenoid itself. It looks like a butterfly. It's really beautiful. It's one of my favorites. Also, on the medial aspect of the orbit, we can see a portion of the ethmoid bone, which again, we can view from the intracranial space, and we'll talk about it in reference to the cranial nerve that it's associated with. We also have another small bone at the medial aspect, just anterior, called the lacrimal. And of course, these are paired on either side, and our lacrimals have unique openings for our tear duct mechanism. Okay? And one that we can't see that is most posterior and inferior, it's called the Palatine Bone. And it's best seen actually in the inferior view of the cranium. You can see the palatine here, but this actually is the seventh bone that composes the eye orbit. Right? So in total, we have the frontal, maxilla, zygomatic, right? Sphenoid, ethmoid, lacrimal, and then your palatine that compose the bony orbit. In this unique example, this is a cast of an individual who suffered a gunshot wound during life. On the left orbit, we can actually appreciate the entrance wound here. So you can see it sort of has a smooth border, and it has blown out many of those sort of delicate bones of the orbit that we cannot appreciate in this example. The exit wound, which can be seen on the posterior aspect, so occipital and our parietal, has a sort of beveled appearance. So you can see that inner table of bone, or the diplo there, from the exit wound, and that's pretty characteristic of that type of injury.